Let's get to the root cause. That's what defines the work of Hamot Health Foundation. Attacking root causes is what led HHF to open a school-based health center in a zip code with no primary care office. At the time, UPMC Hamot Emergency Department was overwhelmed by non-emergent visits, many from that same neighborhood where families had nowhere else to turn for care. So HHF brought primary care directly where it was needed most, keeping families healthier and freeing the ER to handle true emergencies. Attacking root causes is what drove the creation of the Women's Recovery Center at UPMC Hamot. The NICU was caring for newborns experiencing neonatal abstinence syndrome and asked for swaddling blankets to respond compassionately to the crisis in front of them. HHF stepped back and asked a different question. How do we prevent this from happening in the first place? The answer was proactively treating women with substance use disorder. Attacking root causes is what inspired the launch of the Erie Center for Arts and Technology and the UPMC Jameson School of Nursing. At a time when healthcare worker shortages were common nationwide, UPMC Hamot needed trained staff. Meanwhile, Erie residents were eager to work, but lacked access to affordable training options. HHF connected the dots and invested in workforce development that strengthened the hospital and opened doors for the community. Attacking root causes is why HHF is focused on permanent supportive housing. A recent City of Erie report identified chronic homelessness as not only a humanitarian crisis, but an economic development challenge. HHF recognized that without stable housing, healthcare alone could not succeed in stemming the tide of the unhoused. So instead of expanding temporary shelter services, HHF chose to address the root cause, housing first. Along the way, the team has learned invaluable lessons. One of the most important is this: mistrust of traditional healthcare systems is pervasive, especially among those who would benefit most from care. And trust is not easily won. It must be earned. HHF has also learned that improving health requires more than medical care alone. People need a unique blend of support that considers physical health, mental health, economic stability, and human connection. All of this working together, improving together. Addressing root causes requires more than a single initiative, more than a capital campaign. It required a team, so HHF built one. It began with 2 insurance enrollment navigators helping individuals access the health coverage they were entitled to. Over the past 3 years, that role has evolved, and so has its impact. Today, HHF's insurance navigators are also certified community health workers, meeting people at warming shelters, soup kitchens, and inside the hospital. This is what it means to meet people where they are. They are the heartbeat of the street outreach team. HHF then recruited one of UPMC Hamot's rising nursing leaders, someone with a deep passion for community-based care. Her leadership has taken street outreach even further, serving as a catalyst for improved trust, connection, and follow-through. Most recently, HHF added a community outreach coordinator to strengthen and expand the team's work. Together, these roles connect with individuals, identify root causes of poor health, and then walk alongside them as they work towards stability and well-being. Every day, more lives are changed, more lives are saved, even in these early stages of street outreach. This team is touching hundreds of lives per week. But the need for this kind of human-centered care is immense. With additional growth and collaboration, this team can do so much more, not only for individuals, but for the entire community. UPMC Hamot provides exceptional care, ranking in the top decile in Pennsylvania and earning numerous awards, certifications, and designations. What about those who lack the means or the trust to walk through the hospital doors? Street outreach finds them, the forgotten, the overlooked. Street outreach helps people in a way no one else can, through building trust, through connecting resources, through following up and showing up again and again. Because good health shouldn't be reserved for some, it should be for all.